Medicare is complicated, but the decisions you make about it don't have to be. And that's exactly what we're here for. In this video, we'll cover some key things to understand about Medicare and how it fits into your overall retirement financial plan. Healthcare tends to be one of the biggest and hardest to predict costs in retirement, and Medicare plays a major role in covering those costs. Even so, the rules around Medicare can be complicated and may surprise people who thought that they were well prepared. Over the next few minutes, we'll take a look at some important Medicare decisions, including how your income can affect what you pay and how to pick the right coverage for your needs. Let's start with a basic look at how Medicare is set up. Medicare became law in 1965 and now provides health coverage for more than 68 million Americans. The program is divided into four main parts. Part A covers stays in the hospital and is generally free for most retirees. Part B covers visits to the doctor and outpatient care and comes with a monthly cost. Part C, also called Medicare Advantage, is an option offered by private insurance companies that often includes added benefits such as dental and vision care. Finally, Part D covers the cost of prescription medications. A lot of people assume that Medicare is free because they paid in through payroll deductions through their working years. While Part A is indeed free for most people, the monthly cost for Part D, additional coverage, and out-of-pocket expenses can add up quickly. That's why it's so important to include Medicare in your broader financial plan. One of the biggest surprises for many retirees is something called IRMAA. It stands for Income-Related Monthly Adjustment Amount. In plain terms, IRMAA is an extra charge added on top of your regular Medicare Part B and Part D premiums if your income is above a certain level. What makes IRMAA especially tricky is that it works like a cliff rather than a slow, gradual increase. If your income goes even $1 over a threshold, you owe the full extra charge for that entire level. Another layer of complexity is the 2-year look-back rule. The IRMAA surcharge you pay is based on your income from 2 years earlier. So the premiums you pay at age 65 are based on the income when you were 63. This means that any financial choices you made well before you enroll in Medicare, such as converting savings to a Roth, selling investments for a gain, or deciding when to start Social Security, can really affect how much you end up paying for Medicare. There's a lot more to learn about Medicare and IRMAA, which is why planning ahead is so valuable. Beyond managing your income, another very important choice retirees face is deciding between Medigap and Medicare Advantage. From a financial planning point of view, this decision really comes down to how comfortable you are with uncertainty and how much you value predictable costs. Medigap is also called Medicare Supplement Insurance. It works alongside original Medicare to help pay for costs like deductibles and copayments. Monthly premiums tend to be higher, but your out-of-pocket costs are lower and easier to predict. This can be especially helpful for retirees who want just a steady, reliable budget who have regular healthcare needs. Medicare Advantage plans, by contrast, often have lower monthly premiums and may offset extra benefits like dental and vision. However, they can come with higher costs when you actually use the care. Limits on doctors and hospitals that you can visit, and requirements to get referrals before seeing a specialist. In 2025, the average person enrolled in Medicare had 42 different Medicare Advantage plans to choose from, which just shows how carefully you need to compare your options. It's also important to remember that Medicare planning is not something you do just once. Plans, premiums, your health, your income, they can all shift year to year. So reviewing your coverage annually is a smart habit to keep. I hope you found these insights helpful, and if you'd like to learn more about any of these topics, please don't hesitate to reach out. I'd love to hear from you.